The Australian Salaried Medical Officers Federation says doctors are being made to work unsafe hours, including consistent 16-hour shifts with limited breaks. The strikes are adding further strain to public hospital staff numbers, with some elective surgeries already being cancelled.
We're seeing that the decisions our government is making are putting our patients at risk. We're chronically understaffed. We're losing the best minds from the top. We're losing amazing trainees from the sides, and we're simply not being able to recruit and replenish juniors from the bottom.
Our hospital system is in crisis. I've had many of my operating lists at one of the Western Sydney hospitals cancelled because there's no beds available. We haven't even hit flu season yet.
We have doctors who are fleeing to other states and into the private sector just to make their own living.
The union has been pushing for a 30% pay rise, followed by 3% annual increases in the following years to bring wages in line with other states. The state government had counter-offered with a 10.5% increase over 3 years, with 3% to be backdated immediately if the strike was cancelled. Yesterday's last-minute negotiations failed to achieve a breakthrough.
I understand, so too does the Premier and Treasurer, that working men and women need an increase in pay. What we can't do is try and make up over a decade of wage suppression through the wages cap up in a single year. That's not possible. I don't think it's reasonable, but we remain willing to continue to have these discussions and negotiations and use the independent umpire, the Industrial Relations Commission, that the union movement asked us to have and put in place.
Well, for more on this, I'm joined now by Dr. Tom Morrison, who's a neurosurgery registrar and a junior vice president at the Doctors Union. Tom, thank you so much for coming in today.
Thank you for having me.
So you're one of the doctors on strike today. Why?
So 2 weeks ago, I operated at work from 7 a.m. till 10 p.m. I was on call. I went home for about an hour. I was called back for an emergency operation. I was at work from 11 p.m. till 3 a.m. I went back home and I was still expected to turn up for my shift at 7 a.m. the next day. Working conditions in New South Wales are not safe. You can't operate at your best. We can't give the patients the care they deserve with the way things currently are.
Can you describe some of the adverse effects that you're seeing on both doctors and patients when doctors are so overworked? How do you walk into work at 7 a.m. after a shift like that?
It's incredibly hard. I think we're just so used to it because the system has been like this for so long, but we know in our heart of hearts we're not giving our patients our best care that we can. We've talked to the government for 18 months. I've raised these concerns, but unfortunately we haven't been able to get anywhere, and that's why we're taking this action today.
There are thousands of doctors on strike across the state today. The union has said that there is no risk to patient safety today, but with so many people not at work, surely that's leaving hospitals more understaffed, right? Let
me be very clear. No doctor, any doctor anywhere in this state would ever do anything that makes patients' care unsafe. The things that there are disruptions to, things like elective surgery, outpatient bookings, things that are not time critical. If you go to any hospital in New South Wales, my colleagues will take care of you exactly the same if it is an emergency they would any other time.
What sort of flow-on effects do you think that these next 3 days will have on operating lists over the next few weeks and months?
We're already behind. The state government's elective surgery list is burgeoning. It's at its worst it's ever been, I think, in the last report by the government. Of course, that will worsen. However, the system's at a crisis. We're at our wits' end. No doctor wants to be on strike. Personally, it's very weird to not be at work. It's nothing I've ever done. We're not a particularly aggressive or militant group of people, but it's just got to such a state we don't see any alternative.
You're asking for a 30% pay rise. That is a fairly steep increase. We just heard the government, the minister there describing it as unreasonable. Why are you seeking 30%?
We just want to be paid in a comparable or parity to other states. We don't want to be the best paid doctors in Australia, but at the moment we're the worst, and we're the worst by a long shot, and the system is unsustainable.
The strike that's happening today and over the next couple of days is one that hasn't been approved by the Industrial Relations Commission. Can you just explain how and why it's still going ahead, and is there any legal risk to doctors such as yourself?
Well, I think we don't see ourselves as having any other option. You wouldn't have 5,000 doctors signing up to take industrial action if the system wasn't at a state of absolute crisis. We've been with the government for 18 months. We've actually gotten no offer of increased pay throughout that entire time. That's why we've decided we need to take this drastic step.
This strike has been going for a few hours now so far today. Has there been any movement on any of these conversations with the government? Do you expect that you will still strike for the next 2 days?
I'm very hopeful the government will come to us and make a reasonable offer in good faith. We'd like to stop the strike. We'd like to stop it now, but at the moment we have nothing.